morning, everyone. So today my topic is going to continue on health topics that's being discussed throughout the country. And this one is going to be on ALS. Some of us call it Lou Gehrig's disease. Many of you should remember the Ice Bucket Challenge, and this is a part of that. So what is ALS? So ALS is definitely, the ALS stands for amyotrophic lateral sclerosis, commonly known as Lou Gehrig's disease. It's a progressive neurodegenerative disease that affects nerve cells in the brain and the spinal cord. Amyotrophic comes from the Greek language. A means no, myo refers to muscle, trophic means nourishment. So amyotrophic means no muscle nourishment, and when a muscle has no nourishment, it atrophies or wastes away. Lateral identifies the areas of a person's spinal cord where portions of the nerve cells that signal and control the muscles are located. As this area degenerates, it leads to scarring or hardening or sclerosis in that region. And here's a photo of where it really affects. So what causes ALS? Although the cause of ALS is not completely understood, recent research suggests that multiple complex factors contribute to the death of motor neurons. Specific risk factors for ALS have not been conclusively identified, but ongoing research is exploring the possible role of genetics and/or environmental factors. Research published in 2009 suggests that smoking tobacco may heighten a person's risk for ALS as well. Anyone or more of the following factors may be responsible for the disease: defective glutamate metabolism, free radical injury, mitochondrial dysfunction, gene defects, programmed cell death or apoptosis, cytoskeleton protein defects, autoimmune and inflammatory mechanisms, accumulation of protein aggregates, and viral infections. It is also likely that specific gene mutations and/or hereditary modifies the disease and the likelihood of developing it. So what are the symptoms of ALS? With ALS, one may first have weakness in a limb that develops over a matter of days or more, commonly a few weeks. Then several weeks to months later, weakness develops into another limb. Sometimes the initial problem can be one of slurred speech or trouble swallowing. As ALS progresses, though, more and more symptoms are noticed. These are most common symptoms of ALS: twitching and cramping of muscles, especially those in the hands and feet, loss of motor control in the hands and arms, impairment in the use of the arms and the legs, tripping and falling, dropping things, persistent fatigue, uncontrollable periods of laughing or crying, slurred or thick speech, and trouble in projecting the voice. As the disease progresses, symptoms may include trouble breathing, trouble swallowing, and paralysis. The symptoms of ALS may look like other conditions or medical problems. Always see your healthcare provider for a diagnosis. And that's not only for ALS, but for any illness as well. You want to see a healthcare provider for the diagnosis. How is ALS diagnosed? There's no specific test to diagnose ALS. Your healthcare provider will consider the natural medical history and symptoms and will do certain tests to rule out other conditions, including lab tests, muscle or nerve biopsy, or a spinal tap, also called a lumbar puncture. X-rays are sometimes done. This test uses invisible electromagnetic energy beams to produce images of internal tissues, bones, and organs onto film. They can also do an MRI or an EMG. Types of ALS. There are two types of ALS. A sporadic. This is the most common form of ALS here in the US and around the world, making up to 90% to 95% of all cases. These cases occur randomly without any known cause, and there is no family history of this. Familial. This form of ALS affects a small amount of people and is thought to be inherited. So how is ALS treated? For most people with ALS, the main treatment may include managing symptoms. This may include physical, occupational, speech, respiratory, and nutritional therapies. Some medicines and heat or whirlpool therapy may help ease muscle cramping. Exercise in moderation may help maintain muscle strength and function. There is no cure and no proven treatment for ALS, but the FDA has approved the medicines riluzole and evanferone. These medications may improve survival or slow physical decline in people with ALS. Coping with ALS and managing your symptoms is challenging for you, as well as for the caregivers and the healthcare team. But it's important to know that there are many community resources available as well to support with the assistance and treatment. Researchers are conducting studies to better understand the genes and that may cause the disease. They are looking at the mechanism that can trigger motor neurons to degenerate in ALS. And they are also looking at ways to stop the progress leading to cell death. Treatments, as I just discussed earlier, proper body positioning, exercise regimens, physical and occupational therapy, devices and supports to help people walk, braces and splints for legs and arms, customized wheelchairs, home assessment to make it easier to get around in the house, technological devices that help people communicate, suggestions for easier to swallow foods and liquids, support from a nutritionist, feeding tubes, diaphragm pacers, and devices to help support breathing. What are some of the complications? Because there's no cure for ALS thus far, for most people, the disease will progress over 3 to 5 years, making voluntary movements of arms and legs impossible. In other people, the disease may rapidly worsen over a few months or have a very slow course over many years. Each person is affected differently. In time, the individual affected will need help with personal care, eating, and mobility. Movement of the diaphragm for breathing is also impaired. One may need a machine, a ventilator for breathing. Most people with ALS die from respiratory failure. People with ALS are at risk of other complications because of the loss of mobility. These include pressure injuries. They are also at risk for losing weight from loss of muscle mass, as well as malnourishment. Muscle stiffness develops from spasticity. This can make mobility worse and cause discomfort. Some people will drool because of lower facial weakness. Some facts about ALS: 90% of cases occur within family history. Every 90 minutes, someone is diagnosed or someone passes away from ALS. Thus far, there's no cure for ALS. Most people live 2 to 5 years maximum once they're diagnosed. Key points about ALS. ALS is a fatal motor neuron disease. It is characterized by progressive degeneration of nerve cells in the spinal cord and brain. ALS affects voluntary control of arms and legs and leads to trouble breathing. ALS does not affect intelligence, thinking, seeing, or hearing. There is no known cure for ALS. Treatment for ALS focuses on managing or minimizing symptoms as much as possible. ALS most often affects people between the ages of 40 and 70, but it can occur at a younger age. It affects people of all races and ethnic backgrounds. Support groups that are available for the patients and their caregivers: Eleanor and Lou Gehrig's ALS Center, ALS Association, and ALS Society of Canada. I want to give special acknowledgement to Hospital for Special Surgery, Cedars-Sinai Medical Center, Hopkins Medicine, and ALS.org for the information that I was able to provide to you today. I hope this was helpful. I know it's a scary thing to hear about. Unfortunately, this is a disease that I lost the First Lady, the mother of my church, to. And so I wanted to make everyone aware of this disease, that it is real, it is out there, and it's important that we educate ourselves on this as well. God bless you and enjoy the rest of the service. And feel free to join me in the Zoom room should you have any questions about this as well. Thank you so much.